Hello, my name is Ginger Browning and I'm the Airway Clearance Specialist at Cincinnati Children's Hospital and the Outpatient CF Clinic.
And my name is Carolina Sprinkle and I am the CF Coordinator on the inpatient side of our CF Center.
Today we're going to talk about the VEST Airway Clearance System. It is one of our airway clearance modalities. We're going to tell you a little bit how our protocols work and how you get the patient into the vest.
Here at Cincinnati Children's Hospital, we start measuring our patients at 8 months of age, and the patient needs to measure 18 inches to fit into a vest. Then thereafter, when they come into either the clinic or maybe the inpatient setting, we measure them again to make sure that their vest is still fitting appropriately. We want to make sure that it's still fitting good underneath their arms, and that you can still fit a fist inside of the vest, between the vest and the patient. If the patient has maybe a port or a feeding tube, we also want to make sure the patient is comfortable when using their vest. So we will use the foam padding to make that a little more comfortable for the patient if need be. And so you want to make sure that that fits appropriately inside of the vest as well.
So at Cincinnati Children's we have two different protocols that we use. One is our standard vest therapy settings and another is the Minnesota protocol settings. So from when they measure into the vest up until 5 years of age, we do the standard settings, and those are frequencies of 11, 12, 13, and 14 on a minimal pressure of 5 for 6 minutes on each cycle. I can show you how to program that into the machine. When you turn the machine on, you are going to see normal and customs. If you go under customs, this is where you can program the machine. So there's two programs. There's a program A and a program B. So these may be set up from your clinic already with settings in them. If you need to reprogram it, you go down here where it says new. So if I go under new, first question it's going to ask me is about the cough pause. So when the children start the Minnesota protocol at 5, we add in the huff coughs. So right now for the standard settings, we don't need that. So we leave it on 0, and then you just hit on to go to the next section. And then this is where I'm going to start changing the frequencies, the pressure, and the time. So at this point, we would change this frequency to 11. And then this would be a 5. And this would be 6 for the minutes. And I hit on to save it. This next one is going to go up to 12. This is going to go down to 5. This is going to go up to 6, and I hit on to save it. This one is going to go to 13. This is going to go back down to 5. This is going to go up to 6, and on to save it. This is going to go to 14. This is going to stay at 5, and then this is going to go up to 6 for your minutes. This completes our protocol for the standard settings. I hit on to save it. At this point, you just want to make sure that your time says 0, so this machine knows to not go any further, so this will be its end point. Then you hit on again, and now it is all programmed in and it's set to go. So if the patient was in here and ready to use this, we would go ahead and just hit on and it would go through this protocol.
So Sam's going to put the vest on for us. And we're going to demonstrate the standard protocol first. And as Ginger said, the standard protocol is Hertz 11 through 14 and a pressure of 6 for 6 minutes each. We're not going to do the full 6 minutes for each of those settings, but we're going to do a minute on each of the Hertz, just so you can kind of see how that goes. And I'm going to put that one on. Okay, so Sam's starting out at a Hertz of 11, pressure of 6 for 6 minutes, and during this time she would be taking her albuterol. That would be starting right about now, if that's ordered. But Sam is definitely old enough to do Minnesota protocol, which is what she typically does at home. Okay, so once the 6 minutes is up, Sam will give us a good demonstration of what a real huff cough looks like. Okay, so now we're going to move on to our next cycle, cycle number 2. Sam will start at a hertz of 12 and a pressure of 6 and the time of 6 minutes. So our frequency has increased a little bit, pressure remains the same, and the time remains the same. And when 6 minutes has elapsed, she will again huff cough. And we will go up to cycle number 3, which is a hertz of 13, the pressure of 6, and time of 6. And about this time, if she's on any kind of mucolytic, whether it be hypertonic or pulmozyme, we would start that probably around this point because her albuterol would run out. So those medications can actually be given during the vest, both protocols. And then once that cycle is done, again, Sam will huff cough. Perfect. And then we'll finish up with the last cycle, which is a hertz of 14, pressure 6, and the time remains at 6. So basically with this protocol, the only thing changing is your hertz each time. Once the final cycle is finished, Sam will give another round of huff coughs. And I will add that if Sam had a steroid or antibiotic that would be ordered, we would probably we always do these at the end of airway clearance. After all huff coughs are complete, she would do her antibiotic or her steroid. And that's for both protocols, or any airway clearance. We always want to do antibiotic and steroid after airway clearance and huff coughs are complete on clean lungs. You want that medication to be delivered to clean lungs.
When our children here at Cincinnati Children are 5 and older, we switch them to the Minnesota protocol. So the Minnesota protocol consists of 6 different frequencies. It is a frequency of 8, 9, and 10, and then 18, 19, and 20. These are lower and higher than the standard settings that they're used to. With this vest, you will do the highest pressure that you can tolerate comfortably, and then we go down as the frequencies go up. And then the time on this is 5 minutes each, so it's 30 minutes. So it's about 6 minutes longer than the standard setting protocol. So to program this machine, I'm going to turn it on. You're going to see your normal and your customs. You're going to go under custom. And then for this one, we are going to go under the new to go ahead and start programming this machine. Once it's programmed, you go under program A, and then the settings will be there. So I hit new, and again, at this point, it's going to ask you about your cough pause, and we do want it to pause now. So we're going to put a 5-minute cough pause in here, so that means every 5 minutes it's going to pause for them to cough. I'm going to hit on to save it. It's going to ask me how long do I want that pause to be. I'm going to increase it to about 20 seconds. You can do anywhere between 20 to 30. That should be a significant amount of time for a huff cough. And then I'm going to hit on to save it. And I'm going to take this frequency down to 8. If this was a 5-year-old that I was just starting out with, I would start with their pressure on a 6, and then the time is going to be 5 minutes. I'm going to hit on to save this. I am going to take this to 9. And then this is going to still stay on the 6, and it's still going to say 5 minutes. On to save it. This is going to go to 10. And at this point, I'm going to take the pressure down by 1. So it's going to go to a 5, and it's going to be 5 minutes. And we hit on to save it. And then it's going to go up to 18. And then we're going to take the pressure down to 4. And the minutes is going to stay at 5. On to save it. Then we're going to go to 19, 5. And then this should be 5 minutes. And then on to save it. And then 20, 5, and 5. On to save it. Again, at this point, you want to make sure there's 0 in the minutes so the machine knows to stop and not go any further. So then I'm going to hit on to save it, and now it is ready to go through the protocol. So at this point, we would just turn it on, and it would go through all of those settings, and it would pause for the huff coughs for the patient as a reminder for them to do those coughs.
Now we're going to move on to Minnesota protocol. And again, she would begin with her albuterol, her bronchodilator. But we are going to start with our Hertz of 8. And the pressure, a good starting point, as I mentioned before, is 8 and is a Hertz of 8 and a pressure of 8 for our kids. But if you have to move up or down for patient tolerance, that's appropriate as well. And the minutes then moves to 5, but we have 6 cycles. And then we'll and that is cycle number 1. Cycle number 2, the Hertz will move to 9. The pressure remains the same, and the minutes remains the same. So we have a Hertz of 9, pressure of 8, and still 5 minutes. And now we'll move up to our 3rd cycle. The Hertz goes up to 10. The pressure will go down by 1. And since she started on a pressure of 8, we'll go down to 7. And then the minutes remains the same at 5. And then and this would be when Sam would stop and huff cough. And probably here about this time we would be starting her mucolytic or hypertonic, or her pulmozyme would be about now. So now we're going to move up to the 4th cycle. So the Hertz will go up to 18. The pressure is going to go down by 2. So she started at 8, she went down to 7, now she's going to go down to 5. And the minutes remain at 5. If the mucolytic is completed at this point, Sam would be breathing normal saline, of course, to keep everything nice and moist and moving in there. She, of course, would stop and huff cough here. And then we will go up to our 5th cycle. The Hertz moves to 19, the pressure remains at 5, and the time remains at 5.
So some tips that you can do with your patients while they're on the vest, especially for the families at home, I can talk about, you need to keep them busy and occupied so that they don't dislike their treatment so much. So one of the things they can do while they're on the vest is they could definitely play with some toys. You could read books to them. They could watch their favorite TV show. Just anything that's going to keep them engaged so that they're not thinking about doing this treatment and not liking it at that time.
And she has one more cycle to go. She would stop and huff cough, continue with her normal saline treatment, and we go up to a Hertz of 20, a pressure of 5, and the time of 5. And then she would stop and huff cough, and of course if she had any antibiotic or steroid, this is the time that would be delivered. She did a great job. Ginger showed you how to program both of our protocols. The standard protocol with the Hertz of 11 through 14, and pressure starting usually at 5 to 6. I will say that we start training our patients when they come in the hospital to do huff coughs at a very early age, and even if they're not able to truly grasp that yet at say maybe 3 or 4, we want them to get in the habit of huff coughing. So we will kind of stop the vest in between each cycle and encourage that cough. You may not always get that from a 3 or 4-year-old, but at least get that process started with them. The medications that we do during the standard protocol would be, we would do our bronchodilator, would be your albuterol, and then your mucolytic would follow that. Your either your pulmozyme or your hypertonic, whichever one of those that you're on. Both of those we run during vest therapy with always encouraged coughing and between each cycle on the vest. And then Ginger also talked about the Minnesota protocol. Our typical setting on the inpatient side, we usually start with a Hertz of 8 and a pressure of 8. That's our typical setting for that. But if you have a smaller patient that's around 5 years old, like she mentioned, you may have to bump those starting settings down just a little bit. And we always, at 5 years old, huff coughing starts with all our patients at 5 years old. They should be getting more proficient with that. I will say with Minnesota protocol, it is a little bit longer treatment, and you are increasing the aeration a little bit more with those higher settings, the 18, 19, and 20. So the typical medications that we would do during that treatment would be the albuterol, and then you would do your mucolytic, whichever one they would be getting at the time, the hypertonic or their pulmozyme, and then we go ahead and finish that treatment up and keep the moisture going with some normal saline. We don't ever want that nebulizer to run dry because that can be very drying to the mucosa, and you defeat the purpose of that protocol by drying out the mucus. You want to keep everything nice and mobile and moving during that protocol. But that's really about it. Can you think of anything else to add to that?
I was going to say sometimes when our patients come in, if they're 5 and older, the expectation is always to do the Minnesota protocol, but if they cannot tolerate it, we will allow them to do the standard settings, and with that older population, they should definitely be doing huff coughs with those as well.